we're joined by Anne Pfitzer, Family Planning Director at USAID's Momentum 2A. She's going to talk a little bit about the essential reproductive maternal health services that need to continue and some of the policies that need to be put in place in this emergency response. So thanks for joining us. The first question is, what essential reproductive maternal and child health services are critical for health systems to maintain during COVID-19? And is this possible to even, maintain these services?
Well, pregnancies still occur during difficult times, whether it's in conflicts or natural disasters and pandemics. So couples may certainly want to avoid new pregnancies during these difficult times and need access to family planning. But there are also established pregnancies where women will still require professional attention to detect and manage complications, have a safe birth, and provide a good preventive care for their newborn and infants. So while some health workers will get shifted to care for a surge in sick patients, health systems should really ensure some staff continue to provide those essential services to women and babies. Otherwise, there'll be a spike in mortality to those populations separate from any COVID-19 deaths.
Okay, that's really great. So a great point to bring up. Can you elaborate a little bit more on why postpartum family planning is considered essential at this time and can't be forgotten, and what policies are needed to make sure these services continue in the face of a global pandemic?
Pregnancies that occur too soon after a previous birth are associated with worse outcomes for both the mother and the baby. And this is especially true for young mothers or older mothers, mothers who've had 4 or more children. So postpartum family planning is trying to prevent those risky pregnancies. And we also know from surveys that women typically don't want another pregnancy right after they've given birth. So, but in terms of pregnancy policies, the good news is that most FP 2020 commitment-making countries have already established postpartum family planning in their national strategies and guidelines. So what we should ensure is that as they develop new COVID-related guidelines, family planning in general and postpartum family planning in particular is included as an essential service. Operationally, that means bringing up the subject of postpartum family planning at every opportunity when a health worker sees or speaks with a pregnant woman or a woman during childbirth or during those contacts in the first year after a birth. Women are not always entirely clear about when pregnancy is possible after a birth, so integrating that counseling and the provision of contraception during those same visits can encourage both the early adoption of postpartum family planning and also reduce the need for women to come back for additional contraceptive services. Of course, guidelines should also help facilities make sure that those services are safe, not just for women and babies, but also for the health workers in terms of social distancing, infection prevention and control, and so forth. And if possible, if health workers are willing to engage in some contingency planning where they can remain in touch with women in this critical time by WhatsApp or phone, that could help maintain quality between the essential visits. We are also concerned and seeing already that because of COVID-19, women are afraid to come into facilities for antenatal care or childbirth or immunization services. So we need to have communication efforts that both allays their fear, but also considers taking some of this postpartum family planning information out into the community through social media, through radio, call-in shows, etc.
Okay, great. Yeah, those are some really good ideas and to take forward. So can you also explain more of the interconnectedness of postpartum family planning and nutrition and immunization and all of the other health services that are needed?
Yes, there's a strong link between breastfeeding practices and the timing of the return to ovulatory cycles. So while women don't need to understand all the physiological mechanisms, if we can consistently encourage women and girls to exclusively breastfeed, if it's possible for them, it establishes that strong nutritional foundation for their baby and is a key to child survival regardless of COVID-19. But it also gives mothers that extra time that they may need to choose a contraceptive method that's right for them. So what is important is that they should know that if they introduce additional caloric food or contraceptive or liquids to their baby, they should think about a contraceptive method or have a backup plan like emergency contraceptive pills on hand to mitigate that problem. You raised the question of immunization, which is also an essential service. And we don't want babies to miss out on their vaccination because of COVID-19 and then fall sick and die because of those vaccine preventable diseases. But the people who bring babies for immunizations are typically the mother, and they're within that year postpartum. So it's a golden opportunity not to miss to link the postpartum family planning with the immunization visit, and to do so either in a health facility or even during some community outreach.
Okay, great. Thank you. And, knowing that there are some challenges still right now, right, with immunization programs continuing and the outreach and the social distancing and some of the things that communities are up against. Do you have tools that to provide or that people could look to for help in this?
In how to link services during immunization?
Or any of what you discussed, the family planning and.
Yes, I think there's a lot of different tools. JPIGO just recently put out a document that lists how family planning services, essential services, should be maintained during COVID-19. And it has links to various WHO guidelines and so forth about how to get into the details of organizing services during this pandemic. We also have training materials, and our training materials are often designed in such a way that they can be quite quickly converted to virtual platforms. And so we're absolutely prepared to help countries who are interested in providing some of that training virtually. There are myriad examples of sort of educational materials that countries have developed around postpartum family planning, but those should really be designed with the local community and the understanding of the social norms and barriers at the local level. But we can also assist in that process as desired. We have an e-learning course, for example, on how to do social and behavior change for postpartum family planning. I'd be happy to share some links.
Okay, great. Yeah, we'll share those with this. And I think you bring up a really important point in working with the local community in those sorts of messaging and how you roll these things out. Is there anything else you want to talk about that's on top of mind in terms of COVID-19 and your work and your concerns for women and children?
I think we're all bracing for what is going to be some very difficult times. And I guess my top line message is not to forget that women and babies still need care, and that we don't want to see a repeat of some experiences we saw with the Ebola epidemic, where the number of deaths from lack of access to services spiked in addition to those related to the epidemic.
Yeah, important lessons learned there. And it's only in recent history as well.
Right.
Yeah. So thank you so much for joining us. And we'll follow up with you as the situation progresses and things might change.
That would be fantastic. Thank you so much.